Hey, good morning, Amanda. Good morning to everyone on the call as well.
Good morning.
Good morning, everyone. I'm Rebecca Vickers, and on behalf of the Florida Alcohol and Drug Abuse Association, welcome to today's webinar entitled Integrating Substance Use Prevention with Wellness. This webinar is being made available through collaboration of the Florida Department of Children and Families, Office of Substance Abuse and Mental Health, and the Florida Alcohol and Drug Abuse Association. Please note that as an attendee, you are in listen-only mode. If you have questions, please send them to the presenter by using the chat panel. The button to open the panel is usually located in the lower right side of your monitor. Please use the chat panel to send any questions you may have as you think of them. The presenter will address questions as time permits. Our audio is broadcast through the internet to your computer. If you experience poor computer audio, there are a few options to try on screen right now, and these options will be posted in the chat panel throughout the presentation, as well as a copy of the slides. If you continue to experience poor audio through your computer, try rejoining the webinar and use the I will call in telephone option. You must be connected to the audio of this presentation and view it on screen as well to receive a certificate of attendance. The recordings and materials used in today's presentation will be available on FADA's website within 30 business days. To access the recording and PowerPoint, go to www.fada.org, then to our Resource Center, and then on to our training library. Produces many webinars and workshops through the support of the Florida Department of Children and Families. To help participants track credits earned through attendance, we host an online community that provides a personalized digital journal where participants can maintain statements of credit for webinars and workshops taken through the Florida Alcohol and Drug Abuse Association. At the end of today's webinar, your web browser will direct everyone to an evaluation form on FADA's website. You will first need to register or sign into your account to complete the evaluation. Information you provide FADA as a part of registration remains confidential. Statements of credit will be posted 30 business days after the evaluation closes for persons completing the evaluation and attending the full webinar. Completing the evaluation is necessary to receive CE credits or to access your statement of credit. Please note that the evaluation will close midnight Tuesday, June 6th. Up to 2 general continuing education credits are available for participating in today's webinar for persons licensed through the Board of Nursing, the Board of Clinical Social Work, Marriage and Family Therapy, and Mental Health Counseling, and for persons credentialed through the Florida Certification Board. If you are a licensed healthcare practitioner, be sure to include your Florida license numbers for reporting to CE Broker when you register with our site for the first time. If you are certified with the Florida Certification Board or licensed outside of the state of Florida, you do not need to provide your certification number when you register with our site. Please note that WebEx monitors arrivals and departures of attendees and provides a report upon completion of the event. And now I'd like to introduce our presenter for today. Amanda Bonham-Lovett, I think I'm saying it right, is the Program Director of Idea Exchange Pinellas. Prior to her current position, Amanda provided direct clinical services in intensive outpatient therapy settings, private practice, and substance abuse counseling. Amanda began her career developing and evaluating a national positive youth prevention program while completing a Master's of Public Health at the University of South Florida with a focus in behavioral health. Subsequently, she earned her Master's of Social Work focusing on justice-involved individual and substance use treatment. Amanda brings a multidisciplinary approach using years of public health program development, advocacy, grant writing, and direct clinical experience. And now, Amanda, I will turn this presentation over to you.
Thank you, Rebecca. That was a great intro. Good morning, everyone. Thank you so much for being here with us this morning. As Rebecca said, I am Amanda Bonham-Lovett, and I will be with you for the next 2 hours talking about integrating substance use prevention with wellness. If any of you would like to, just kind of drop where you're at in the chat so we can see if anyone's nearby. I'm in Pinellas County here. It's been raining for like a whole day, and now it's finally sunny, which is so nice. So if you want, say where you're at, where you're joining from, and we'll go ahead and get started. So Rebecca did a great job of introducing me. But again, my name is Amanda Bonham-Lovett. I'm the program director for Idea Exchange Pinellas, which is Florida's 6th syringe service program. It took about 8 years to develop and actually implement. It's a long journey. So that's where I'm focusing my efforts right now. And if you have any need to contact me or learn any more information, my email is there at the bottom. The organization I work for is the Pinellas Ex-Offender Reentry Coalition. So the email is abonhamlovett@exoffender.org. And again, if you have any questions, please drop them in the chat and I will do my best to monitor them and respond accordingly. All right, so let's get into the objectives of this presentation. The first one we'll cover is describing substance use prevention strategies and wellness practices. The second objective is to identify substance use prevention programs and resources in Florida. And the last one is to discuss the intersection of substance use prevention and wellness across the lifespan with a focus on adolescent prevention. Great, here's some more information on substance use prevention. The National Institute on Drug Abuse, NIDA, identifies prevention as the best strategy to avert substance use among youth. So that's really one of the big focuses of this webinar is how can we target youth to prevent the development of substance use disorder? Next, the substance use prevention practices aim to increase protective factors and minimize risk factors for substance misuse. So looking at a lot of kind of what those risk factors are across the lifespan, as well as the protective factors so that we can enhance and increase protective factors. And then third, substance use prevention strategies range from abstinence-based messaging to targeted naloxone distribution. So there's quite an array of substance use prevention strategies, and hopefully we'll touch on quite a few of those today in the webinar. Prevention and early intervention strategies can reduce the impact of substance use and mental disorders in America's communities. Prevention activities work to educate and support individuals and communities to prevent the use and misuse of drugs and the development of substance use disorders. And that is a quote from SAMHSA, the Substance Abuse and Mental Health Services Administration. So education and support are really big components that we need to look at all of those socio-ecological levels. And now we'll just briefly cover the prevention definition. So primary, secondary, and tertiary. This is a great way to just categorize different efforts of prevention. So primary is what most people think of when they think of prevention. So that's trying to prevent a disorder from developing. So that's really what we see, like this abstinence-based messaging is a big focus, of course. Secondary is early disease detection and treatment. And then tertiary is managing an existing disease to prevent complications or worsening of the condition. These are just basic definitions, and then we will apply them to substance use prevention. Okay, I've got a question for you all. Medication-assisted treatment, or MAT, is an evidence-based treatment for opioid use disorder that combines FDA-approved medications with counseling and behavioral therapies. So it's a little different from MOUD, which is just medication for opioid use disorders, since this combines the medication with the counseling and behavioral therapies. So with that information there, would you all consider MAT a secondary or tertiary prevention strategy? Go ahead and put your answers in the chat. I'm hoping to have a bit of a discussion on this because I think this can be played a few different ways. So I'm curious to see what you all think and your opinion on it. There's no right or wrong answer. I'm just interested to see what you all think. I'll give you a minute or two to see what we got in the chat. And if you want, I will go back to that slide that goes over the definitions. So secondary is early disease detection and treatment. And then tertiary is managing an existing disease to prevent complications or worsening of the condition. Okay, so I'm not really getting any messages in the chat. Oh, there's quite a few of you on here, and I know you all have experience in this field. So let's someone shoot off an answer so we can kind of discuss this a bit. All right, so I think that MAT services combine components from secondary and tertiary prevention. So secondary is that screening and monitoring component. So that would be really monitoring, when you're in a MAP program, they monitor your use through your analysis, making sure that you're not taking different substances outside of what is prescribed. So that would kind of be those secondary practices. And then the tertiary practices would be actually treating the opioid use disorder that's already been developed with the medication and the behavioral therapies. So I hope you all got a little bit out of that, because I think I asked this question to quite a few of my colleagues, and I think there are varying opinions on this. All right. So now we'll focus in on substance use primary prevention. So primary prevention efforts for substance use really focus on preventing substance use problems from developing. So again, kind of focusing in on usually that youth population. And the efforts focus on promoting healthy behaviors, attitudes, and environments that reduce the risk of substance use and misuse. So it's also helping to identify those people who may be at risk for developing a substance use disorder and misuse. And the efforts are most effective when implemented early, prior to the development of a substance use disorder. So again, targeting youth primarily for this. And then here are some primary prevention examples. So I kind of laid this out so we can look at it across the different models. So we've got education programs, community-based interventions, parenting programs, policy interventions, and media campaigns. So examples of the education programs would be providing accurate information about substance use risks, tips for avoiding substance use, and navigating social pressure. So really providing that education, ensuring that we're building strong, resilient children, and have to navigate those more challenging situations that inevitably arise in childhood. Community-based interventions create supportive environments and discourage substance use while promoting healthy behaviors. And then we've got parenting programs, and this looks at providing parents the skills and resources to support their children's healthy development and prevent substance use. So making sure that parents are equipped with the correct information, resources, and support that they need to raise healthy children. And then policy interventions at the primary prevention level will be creating laws and regulations to discourage substance use and encourage healthy behaviors. And we'll go over some examples of these specific examples. And then media campaigns would look to raise awareness about risk associated with substance use and the benefits of healthy behaviors. Substance use secondary prevention, we will take a look at that. So these interventions aim to identify and treat substance misuse early. The prevention efforts focus on individuals who may be at increased risk of developing a substance use disorder or are experiencing negative impacts from substance use. Secondary prevention efforts are most effective when integrated with primary prevention efforts, such as education and community-based interventions that aim to prevent substance use problems from developing in the first place. So we really want to have a combined, multifaceted approach when we're looking at substance use prevention. We don't want to just focus on one level of prevention in order to be most effective. So here are some secondary prevention examples. We've got screening and brief interventions. These are utilized to screen individuals at risk to develop a substance use disorder and provide brief intervention to reduce or eliminate risk. So then if the individual is identified as being at risk, a brief intervention can be provided to help them reduce or eliminate their substance use. So this is something I think most of us are probably familiar with, that initial screening that we provide clients to see where they're at and to see if substance use or misuse is a presenting problem for them. Then we've got early intervention programs to address substance use before it becomes severe. These programs may include individual and group counseling, education about the risks of substance use, and support for developing healthy coping skills. Peer mentoring programs provide support and guidance from individuals with lived experience who are now in recovery. And this is a big area that we're seeing highlighted right now, which is wonderful. So the Florida Board now offers the Certified Peer Recovery Specialist certification. So really focusing on how we can incorporate people with lived experience to guide and mentor others who may be at that early stage of wanting to do things differently, maybe wanting to change but not knowing how. So this is a really wonderful layer that we have added to behavioral health by incorporating peer mentoring programs and certification. We've got family therapy, of course. So this is effective to address substance use problems in adolescents and young adults. They can help individuals who are struggling with substance use to feel less isolated and more helpful about their prospects for recovery. So this will also help to just include and improve communication among family members, reduce isolation, provide education to family members about substance use, and of course, strategies for preventing return to use for that family member. In workplace programs. Yeah.
And I don't mean to interrupt, but we've just gotten word that for whatever reason, the chat, and so for all the participants that are on this webinar, please listen up right now. The chat function is not working and we're not sure why. So people are not ignoring you, Amanda. They can't chat back to you. And I'm not sure why, and I'm trying to work on it, but I don't know that it will be available. Maybe on the break I can try a couple things, but I'm just letting you know that the chat function is not working to all of the participants and to you, Amanda.
Okay, thank you. I was just like, wow, they're just really not chatting
No,
this
they
morning.
can't chat. They can't. I don't know why, but they can't chat right now. So we've never had this issue before. So I just wanted to let you know once again, for everyone who is listening, the chat function is not working and we are aware. Thank you, Amanda.
Thanks, Rebecca. Well, that's a bummer. If it's still an issue and you have questions or things, I will make sure I put my email address in the chat again, so you can reach out to me personally after this. And I was hoping to have more engagement, but I know you're there. And so hopefully we can get that situated and figured out. So jumping back into it. So the last strategy here for the secondary prevention examples is focusing on those workplace programs that assist to identify substance use problems and provide support for employees who may be at risk of substance misuse. So most of you would probably be familiar with kind of those employee assisted programs, EAPs, so providing employees those like 3 to 5 free behavioral health sessions if someone has been identified as struggling, going through substance use issues or family issues. It can also include just providing basic education, drug testing, and support for employees who are struggling with substance use. Right. Now we've got substance use tertiary prevention. So tertiary prevention efforts focus really on reducing harm and preventing return to use. The interventions aim to prevent the recurrence or worsening of a health condition after it's been diagnosed. So this is kind of what we talked about in my MAT question earlier. Again, the interventions aim to reduce harm and prevent return to use among individuals who have already developed a substance use disorder. So these intervention strategies examples are tailored to persons who are already experiencing substance use disorder or misuse. And the efforts usually are most effective when they are patient-centered, evidence-based, collaborative, and they prioritize comprehensive, coordinated, and ongoing care. And I think most of us would agree with that for all interventions, that they should be patient-centered, evidence-based, collaborative, comprehensive, coordinating, and have ongoing care. They're most effective when they're tailored to the unique needs and circumstances of individuals with substance use disorder. So no person is alike. No two people are alike. So let's go look at some tertiary prevention examples. We've got rehabilitation programs. So this supports individuals recovering from substance use disorder by providing skills to prevent return to use, utilizing individual, family, and group therapy and/or MAT and peer services. So again, you're most familiar with this, like intensive outpatient therapy, inpatient services, really including that stabilization component, treating those underlying issues, providing recovery, rehabilitation, including family and outside supports. And then, of course, any medication-assisted treatment that would be appropriate. And support groups. They provide a safe and supportive environment for individuals in recovery to share experiences, engage in fellowship, and work directly with peers. So some great examples of that would be the 12-step programs like Alcoholics Anonymous, Narcotics Anonymous. Those would be examples of support groups. And we know that that support that is received in those groups is very, very beneficial for sustaining more long-term recovery and helping build someone up if they have returned to use and want to go back into these support groups. It's a really wonderful source of camaraderie and mentorship there. And continuing care. So that would provide ongoing monitoring and support for individuals after they complete treatment. And this is essential, right? So we treat people, we help them, and then sometimes they are just left on their own. Oh, my chat changed. I'm wondering if I'll be able to get chats now. So making sure that there's follow-up care, starting out, bi-weekly, and then it can go every month, every other month, 3 months, 6 months, 9 months, things like that. But it's just imperative that there is that continued point of contact with a person once they have gone through rehabilitation. And we've got relapse prevention plans. These are helpful in assisting the client to outline personal strategies for avoiding triggers, first identifying those triggers, how to avoid them, identify cravings, manage the cravings, prevent return to use, and often this is shared with family members or other support members for that person so that they can also be an added buffer for them. And then lastly, the tertiary prevention example for harm reduction. So this is what I am most focused on right now in my current position. So this aims to minimize the negative consequences of substance use by providing education on safer sex use and prevention of infectious diseases. So looking at targeted naloxone distribution, counties typically track where those overdoses are occurring, those hot spots, and they can ensure that they have first responders nearby, aware of those areas, ensure that there is naloxone on those sites, at those sites. Again, syringe service programs are major harm reduction programs that are cited by World Health Organization, CDC as evidence-based interventions. And we know people who engage in syringe service programs are 5 times more likely to enter substance use treatment. And so really kind of taking snippets from each level of prevention is going to provide the best outcome and the most efficient program strategy. Right. I would say any questions, but I don't, we will move on. But tertiary is one I think that goes, it's not spoken of as much. So if you have any questions, please reach out. This is one of the areas that I'm very, very passionate about. So now we'll talk a little bit about substance use prevention programs. There are a wealth of resources in this presentation, so I will do my best to go over them. But if anything speaks to you, resonates with you, I really encourage you to go back later, visit the PowerPoint, visit these sites, look at this information. There's a lot of information I'm trying to squeeze into these 2 hours. The first one we've got here is the Talk They Hear You campaign. This is a program through SAMHSA, really aimed at parent, caregiver, and community partner resources. It looks to reduce underage drinking and substance use among youth under the age of 21. Again, focusing kind of on the parents, caregivers, to discuss substance use with their children. So more of like a family-based parent approach. And then the second one is another SAMHSA program, the Interagency Coordinating Committee on the Prevention of Underage Drinking. This is national and federal efforts for policy and programming to support state and community activities that prevent and reduce underage drinking. So this is just a great resource when you're looking at more of the policy level efforts, looking for examples on that direction. There's a committee of actually 16 federal agencies, and it's led by SAMHSA. So another great resource if you're looking for ideas on national and federal efforts. And then the Stop Underage Drinking, that's actually the web portal for the program above this, the Interagency Coordinating Committee. This is the web portal where you can go to get lots of resources, looking at funding opportunities that are available to reduce and prevent underage drinking and its consequences. So you can head there for research policy. There's got reports to Congress, again, primarily focused on underage drinking. And moving on, this is a great one too, the National Prevention Week. It actually just passed. The next one will be May 12th to May 18th, 2024, so mark your calendars. This promotes community involvement, resource sharing, and partnership engagement to increase public awareness of substance use and mental disorders. It also provides resources to communities so they can highlight their prevention successes throughout the year. It really showcases the work of communities and organizations across the country and the neat initiatives and successes that they're having, really focusing on raising awareness about the importance of substance misuse prevention and positive mental health. It also has a library of on-demand videos and prevention activities. So again, some more inspiration and resources for you all. If you're feeling stuck and need some inspiration, that would be a great one to check out as well. And then the last one on this slide is the Communities Talk, town hall meetings to prevent underage drinking. This helps you, you can filter on the website by state and then your area to kind of see what activities are happening in your area. It's really looking at community-based organizations and the resources that they need to start or support conversations about evidence-based underage drinking prevention. It's held every 2 years, and they engage multiple stakeholders within each community to mobilize action in underage drinking prevention or strengthen existing prevention programs. Again, this is every 2 years. I believe they just closed out the stipend period, but they do provide stipends to help these organizations, programs organize and conduct community talk events. Right, and then these are substance use prevention programs and resources in Florida. The first one I hope you all are familiar with, FADA, of course, the Florida Alcohol and Drug Abuse Association, which is why we are all here today. Thank you very much. It's a statewide association of addiction treatment providers that works to promote substance use prevention and treatment in Florida. They provide resources and support to individuals and families seeking treatment, as well as to prevention and treatment providers. So lots and lots of trainings that are available, as you all are aware. The next one would be the Florida Department of Children and Families, or DCF, the state agency that provides a range of services related to substance use prevention and treatment. They offer prevention and early intervention services, as well as treatment services for individuals with substance use disorders. And then last on this slide is the Florida Statewide Drug Policy Advisory Council. The council is a group of stakeholders who work to develop and implement policies related to substance use prevention and treatment in Florida. They provide guidance and support to state agencies, community organizations, and treatment providers. So more policy focused, sharing guidance, information, resources to support policies, the development and implementation of policies for substance use prevention. All right, and we've got Too Good for Drugs. And that is a substance use prevention program for students in grades K through 12. It uses a curriculum-based approach to teach students social and emotional skills, decision-making, and goal-setting strategies. Decision-making, and goal-setting strategies to avoid risky behaviors. Sorry, I got distracted there. And then we've got Students Against Destructive Decisions. This is really student-led, this organization. It's a national organization with local chapters throughout Florida that provides education and support to students and families to prevent substance use and other risky behaviors. So you'd see this really in school and community chapters like student clubs. And then the Too Good for Drugs, that really focuses on pro-social behavior. So developing those positive social skill sets that's needed in childhood to prevent substance misuse and use. And then lastly, the National Council on Alcoholism and Drug Dependence. They are a nonprofit organization that provides information, education, and referral services related to substance use prevention and treatment. And the website links to find local assistance. It's a really great resource. If you go on the Florida website, you can search there for linkage to treatment if you are in need of services, as well as just finding other local resources. And then we've got a lovely quote about wellness and wellness paradigm. An emphasis on wellness is a paradigm shift that moves beyond a traditional focus on illness and disease and addresses the broader determinants of health, including physical, social, emotional, intellectual, and spiritual well-being. So this really emphasizes the need to move beyond a traditional focus on illness and disease and adopt a more comprehensive approach to promoting health, looking at those social determinants of health. And that's kind of how this is set up, just looking at across all of those factors and applying substance use prevention. So now we'll dive into more of the wellness model component of the presentation. So I just wanted to do a brief background on what a wellness model is and kind of look at the old traditional model, the medical model. This is what's historically prioritized identifying and treating physical causes of disease, not as much of a focus on prevention. And the beliefs are that disease is caused by specific pathogens or physical abnormalities. Historically, it's failed to incorporate factors outside of the person contributing to the disease. So it does not include your family, your community, your environment, your school policies, things like that, that we all know really shape an individual's health and their health outcomes. And so the importance of prevention efforts were not broadly recognized with that traditional medical model. With the wellness model, it recognizes the importance of social determinants of health and the development and treatment of disease. It's more person-centered, so looking at that person as an individual that has a different life experience than the person that came before, the person who will come after them. really focuses and emphasizes preventative care and patient education. So more one-on-one interaction, having a conversation, understanding a person versus looking at them as just a patient with a chart. So including all of those factors. These are the wellness models that we're going to cover in the next section of the webinar. So we'll go over the 6 dimensions of wellness, the trans-theoretical model of change, the biopsychosocial model, the health belief model, and the social ecological model of health. Some of these models we could do a whole webinar on just in and of themselves. So there is a lot of information packed into this section. But hopefully, again, it will be something, you'll find something new and maybe some inspiration that will help you, and particularly if you have clients or a program that is stuck and you just need a little more insight into how to move them through that change process or look at them through a different lens. So we'll look at the 6 dimensions of wellness first. This is taken from the National Institute of Wellness here. We've got the intellectual, occupational, spiritual, social, emotional, and physical dimensions of wellness. And when you're looking at each of these dimensions of wellness, you really want to include the impacts of key environmental factors. So where you live, where you work, where you learn, where you play, where you reflect, and oftentimes these are not considered. So if you don't have spaces to learn, to play, to reflect, you won't reach that optimal functioning and wellness. And as you can see, the quote at the bottom there says, wellness is functioning optimally within your current environment. That's taken from the National Institute of Wellness. So looking at those 6 dimensions, asking these questions there on the side, making sure that if that's not available, how do we get that to become accessible? So these are the 6 dimensions broken down a little bit more. We've got the physical, which is improving physical wellness, and that can lead to a reduction for the risk of substance use by promoting healthy habits like regular exercise, adequate sleep, and balanced nutrition. So this is a great outline of what wellness entails, and then some of the other models will kind of help us look at how we move through change and look at the factors contributing to the physical health. So assisting a person in ensuring that they can access healthy foods, right? That they're not in a food desert. And if they are, how do we get them to fresh fruits and vegetables that they can afford? Looking at wellness practices that incorporate healthy sleep patterns, looking at your stress levels throughout the day, and exercise. Oftentimes, the people who most need it are not in an area where there are sidewalks readily available to go on a walk, or parks where you can go engage in those free exercise equipment. So really looking at the environment too that contributes to the physical wellness is important. And we have the emotional wellness. So you want to promote resilience and coping skills like mindfulness and cognitive behavioral therapy. We all know this is very, very important, and all of these dimensions play into one another. So this can start in childhood by ensuring that there's proper education and access to support and services for the youth and the parents and caregivers. So ensuring that they've got a tool set that they can take with them to feel centered, mindful, grounded, and they kind of take control of their emotional health and thoughts. And then social. So this encourages positive social interactions and connections like group therapy or support groups. This is quite broad, but focusing in on this wellness component and behavioral health. This is looking at group therapy and support groups. So making sure that there's a space that you feel you can connect with others and you feel supported and heard and understood. That's going to help support your social wellness. And then we've got intellectual. So we would want to look at education and awareness campaigns that provide accurate and up-to-date information on substance use and its impact on the brain and cognitive function. So ensuring that that messaging we're giving on substance use is accurate, it's informative, and it's really catching the attention of the targeted population, making sure it's tailored to the education level of that population. And it's something that they can relate to when they see this information. Occupational wellness. So applying that to substance use prevention would be vocational training and employment programs that provide individuals with purpose and a sense of accomplishment. So making sure that we're looking at fulfillment in occupation, that persons are feeling supported and they have opportunities for growth and training, and just feeling a sense of accomplishment. This leads to optimal wellness. And lastly, we have spiritual. So we would want to encourage individuals to connect with their own spirituality or a higher power, such as mindfulness or meditation. Those are the 6 dimensions of wellness. And we would all like to be functioning optimally in each one of those. I know, and that's not always the case. This gives us a good blueprint for where we would like to be and where we would like to help our clients and population be. So wellness-based approach to substance use prevention can help individuals develop healthy habits and coping mechanisms that promote long-term well-being and reduce the risk of substance use. Right, I would say, are there any questions on this? I don't think I will get them. So I will go ahead and move on to the next model, which is the trans-theoretical model of change. This is a 6-stage process for behavior change. So the first one is pre-contemplation. So we are really looking at assessing an individual's readiness to change through these stages and then tailoring interventions to address specific barriers and facilitators to change at each of these stages. So people will fall into one of these stages, and then there are strategies to help you move through those stages. So the first one is pre-contemplation. So this is when a person's not yet considering change. They're happy with their behavior, with the choices they're making. They're not really considering change or looking at the pros and cons of what that behavior change may do for them. So then the next stage is contemplation. Contemplation is where you start considering a change. You might start weighing the pros and cons of behavior change. You may think, okay, if I continue using this substance for this long, what will it do to my financial well-being, to my family? What are those negative effects? Also looking at the positives. Maybe using the substance makes you feel at ease. It helps you to not think about all the stress in your life. So this is where you would really just start considering, weighing, thinking. And then the next stage from there would be the preparation stage. So this is where you would start to actively prepare to change your behavior. You would start goal setting. So moving through these stages of change can be tricky, but it's a really wonderful foundation just to help you assess your client's population, see where they're at. This can be used for individuals, programs. So the preparation is you haven't started taking action to change the behavior, but you're getting ready. You're getting a lot more serious. You're looking at what that will look like in your life. How will you incorporate that change and that new behavior? And then action. So this is where that specific behavior change is made, and you're actively working towards maintaining change. So applying that change, incorporating it. Now you're actually doing it. What does that look like? How do you maintain this change? So monitoring, assessing, seeing what barriers are there, what success that is happening to keep this change going. From there, you move into the maintenance stage. And this is maintain behavior change for a significant period of time and working towards preventing relapse. So again, this can be used for substance use prevention or a wealth of other health behaviors, programs. So once you kind of achieve that maintenance, then you go into termination. That's where you're fully integrating the behavior change and you no longer need to actively work to maintain it. So it's become a part of who you are, part of your day-to-day. You don't think about it, you don't question it, you don't contemplate it. So let's get at the next slide where we're kind of applying that to substance use prevention. So that would look like at the pre-contemplation stage, increasing awareness of the risks and consequences of substance use. So if that's what the behavior change we're seeking is to change the substance use behavior, we would look at the risks and consequences of substance use. So that's where using that accurate information is most important, and really what's most important for this person or population. Then the contemplation, that would look like considering the pros and cons of stopping or reducing the substance use. So what changes, what impact would that have on you? Would you have to start interacting with certain people that you avoid through isolating through substance use? And that can be a pro and a con. The preparation would look like starting to develop specific coping skills or strategies to support reducing or stopping substance use. So making sure that you're working on your mental, emotional health, physical health. What can you do in order to support yourself as you enact that action stage? And then once you're in that action stage, that would look like, again, working to maintain that change, applying the coping skills you've developed, monitoring yourself, relying on that support that hopefully you've prepared in the preparation stage. Maintenance, again, what we talked about, just using those skills, monitoring yourself, continuing to enact that behavioral change, that behavior. And then termination, it's integrated. You're good. You're ready. You don't need to be monitoring yourself as closely. And so this model of change can help to identify individuals who might benefit from additional support or interventions to move through the stages of change and maintain their behavior change over time. So again, this is just a really great model to apply to maybe a client who is stuck or resistant. And this is something you can talk through them with. You can work on this together, show them this. See what will help them move through these stages. What is their motivation? And how can you best support them? All right. We will take a 5-minute break at the top of the hour. So just hang with me for about 13 more minutes and we'll take a break and hopefully see if we can get the chat up and going again. To the next slide here. So now we'll switch gears to the biopsychosocial model. This is one of the original models I think all of us are familiar with. We are trained in this. So it really gives a basic framework for allowing us to look at a person in a holistic way. We use this model when we're doing those initial intakes, right, and starting to get to know a person better. So specifically, it looks at health and illness being understood through 3 interrelated domains that influence health outcomes. So you're looking at the biological, psychological, and social factors that impact a person's health outcomes. So with the biological factors, that would be their genetics, biochemical factors, and physiological processes. Psychological, we're looking at their cognitive, emotional, and behavioral processes. Social factors would be those interpersonal, cultural, environmental, spiritual factors. These are most often used in clinical settings, the biopsychosocial model. It's used in the assessment, diagnosis, and treatment of health conditions. And it's also used in research to investigate complex interactions that contribute to health and illness. So this is a classic model that is really versatile. It can be used in a variety of settings. one-on-one in clinical settings. It can really help shape the diagnosis and treatment of a person by really looking at their full picture. And it helps that person also understand themselves much better. So let's look at applying the biopsychosocial model to substance use prevention. So that would look like the biological level, educating on the short and long-term effects of substance use on the body. And looking at programs that focus on improving overall physical health and wellness, like exercise and nutrition education, can also be effective in reducing substance abuse. So I know some of this seems like something maybe I mentioned earlier. There's a lot of overlap here. And again, focusing on all these different components of health and wellness to be the most effective at tailoring substance use prevention programs and treatment. So education, education, education. Identifying if a person has risk factors for the development of substance use or certain diseases, and then making sure that they're provided with accurate information so that they can start to kind of weigh those pros and cons of either engaging in substance use or not. And we've got psychological. So this would look like mental health screenings and access to treatment for underlying mental health conditions. Also, interventions that focus on building resilience and coping skills that can help individuals manage stressors and reduce the risk of substance use. So looking at that mental emotional health. How can we screen to identify persons more at risk of developing mental health disorders or substance use disorders, and then provide interventions that help build resilience and coping skills so that the person, program, target population can manage their stressors and reduce the risk of substance use. And then the third stage here would be those social factors, and that would look like education on the risks and consequences of substance use, as well as strategies for resisting peer pressure and developing healthy relationships. Programs that provide opportunities for social connection and support can also be effective in reducing substance use. So again, that's kind of incorporating the community, the school, the workplace, looking at those social factors that can be protective factors to prevent substance use and misuse. Learning how to have healthy relationships, proper communication, engage with others, have support and accountability. So this model can be used to better identify and address underlying factors that can contribute to substance use in specific populations, such as adolescents or individuals with co-occurring disorders. So a really great framework for not just addressing substance use disorder prevention, misuse, but also those with co-occurring diagnoses. So looking at the mental health as well as the substance use. So look at the person as a whole. All right, the health belief model. This is another big public health one. A social psychological model used to explain and predict individuals' health-related behaviors. We've got 6 stages here in this model, so similar to the trans-theoretical model of change. The first one is, again, it's really looking at how people perceive their health-related behaviors, like the impacts of them, and it helps us to understand a population, a person, and where they're at. So the first one is the perceived susceptibility, and that's looking at the belief about the likelihood of contracting a particular illness or disease. So it's important to assess a population, a person, to see where their beliefs lie. Do they think that they're immune to the consequences of substance use? Do they think they're immune to getting infectious disease from IV drug use? What does that look like for the person? Do they believe that they are at a higher susceptibility because they have family members who suffer from substance misuse? Okay. So just looking at their beliefs around that, do they think that it's going to affect them? And then we're going to look at the perceived severity. So this is, okay, you do believe that you're susceptible, but how serious do you think that susceptibility is. What are those consequences going to look like if you do obtain that illness or disease? And then just kind of challenging some of those beliefs, right? Making sure that the information that they are sharing is accurate, providing education in a safe way, a supportive way to encourage making informed decisions. And then you're going to look at the perceived benefits. So that's, again, beliefs about the effectiveness of the recommended health behavior in reducing the risk of illness or disease. So lots and lots of education here, making sure that the information this person has ingrained in their brain is accurate. So providing up-to-date, relevant information about the effectiveness of the health behavior change and its impact on reducing illness or disease. And then you want to look at barriers. There's always a big one, right? So we can give all the information we want all day, but if we don't look at what would actually impede a person from applying this to their life, we're not going to be very successful. So we need to look at the barriers, their beliefs about the difficulties associated with the recommended health behavior. So what beliefs are barriers for them? So maybe it's an example would be the use of condoms, right? So maybe there's different beliefs there that using a condom is just not something that's practiced in their community or their population, and just really giving more updated information about that. And then we've got cues to action. So we're looking at internal or external factors that motivate the individual to take action to prevent or manage the illness or disease. So find out what motivates them internally and externally. What can you use to help them move through those stages of change? And then self-efficacy. So this is their belief and their ability to successfully engage in the recommended health behavior. So where is this person's level of self-esteem and their self-worth? Maybe they understand the severity of their actions, the benefits of stopping their substance use. They know the accurate information. There's no barriers, but maybe they don't have the confidence or the belief in their ability to really engage in the change. So lots of areas here where we can step in and guide and support and inform. So here's again applying this health belief model to substance use prevention. That perceived susceptibility would be illustrating the risks associated with substance use and emphasizing that anyone can become addicted to drugs or alcohol regardless of their age, gender, or socioeconomic status. The perceived severity, this is where we would emphasize the negative consequences of substance use, such as addiction, health problems, and social and economic costs. The perceived benefits, we would highlight the benefits of not using drugs or alcohol, such as improved physical and mental health, better relationships, and academic and professional success. And we've got perceived barriers. So address common barriers to avoiding substance use, such as social pressure, availability of drugs or alcohol, and lack of information or resources. And then the self-efficacy. Provide individuals with the knowledge, skills, and resources necessary to avoid substance use and build self-efficacy through practice and reinforcement. So taking small action steps to really build that self-esteem and get to self-efficacy. So seeing that I can do, make a small change and see success with it, and just continuing that and building on it to get to self-efficacy. All right, so this is a really great model that can be used with individuals, populations, a myriad of health behaviors, of course, substance use prevention. So I guess we'll go ahead and stop there and take our 5-minute break. Rebecca will jump on and see when we'll all be back.
Yes, everyone. Okay, so we will meet back at 11:05. Unfortunately, our IT director is working with WebEx support, and I am not sure that the issue will be fixed over the break. I really don't have any other update other than that as far as the chat goes. So I'm sorry about that to everyone, but I just wanted to let you all know that's where we're at with the chat, and we will meet back at 11:05.
Thank you.
All right, welcome back everyone to today's webinar. We are going to get started right where we left off, and then just a quick reminder once again, we are aware that the chat is not working. We have worked with WebEx. They are working actively to try and get it fixed. But I do not believe it will probably be fixed in time for the end of this webinar. We're very sorry, but hopefully WebEx will have it fixed before the next one. So thank you all very much, and we're going to go ahead and get started again. Amanda, are you able to get started again?
Yes, sorry about that.
Okay. No problem.
All right, welcome back from break, everyone. Thank you again for being here. So we were just wrapping up discussing the health belief model and its application to substance use prevention. I just wanted to reiterate that these can be used in disease prevention programs for substance use prevention, cancer screening, HIV prevention, diabetes management, and vaccination. And now we will go on to another wellness model, the social ecological model. The social ecological model is used as a framework for prevention by the Centers for Disease Control. So here we're looking at the interplay of individual, interpersonal, community, and societal factors. The individual would cover knowledge, attitudes, beliefs, and behaviors. Interpersonal is the social networks, family, peer groups, as well as relationships and interactions between individuals within these groups. So not just the groups themselves, but the interactions between the groups and the individuals. And community. That would be the social and physical environments in which individuals work, live, and play. It includes access to healthcare, education, and employment opportunities, and community resources. And societal. Societal is looking at the cultural norms, policies, and economic conditions that influence health outcomes. So now we'll look at applying the social ecological model to substance use prevention. The social ecological model can be used as a framework for designing health interventions that target multiple levels of influence to promote behavior change and improve health outcomes. So applying this at the individual level would look like education and counseling to improve knowledge, attitudes, and behaviors related to substance use. Next, the interpersonal would be looking at peer education and support groups to strengthen social networks and reduce social pressure to use drugs or alcohol. Community-wide would look at policy and environmental changes to reduce access to drugs or alcohol and increase access to prevention resources. And lastly, societal. We'd be looking at advocacy for public policies that address the social determinants of health and reduce substance use at the population level. Move on to really looking at applying wellness models to substance use prevention. So we went over the models and applying those specific models to substance use prevention. And again, it's a lot of information and we can go into a lot more detail if we had more time. But now we're just going to look at some points and some strategies for applying these wellness models to substance use prevention. By applying wellness models to substance use prevention, we can promote a holistic approach to well-being and address the underlying factors that contribute to substance use. Prevention efforts that address multiple dimensions of wellness and take into account the complex interplay of biopsychosocial factors are more likely to be effective in preventing substance use. So we want to address those multiple dimensions of wellness, like physical, emotional, social, and spiritual health. Prevention efforts that focus on one aspect of wellness, such as physical health, may not be as effective as those that address multiple dimensions. So looking at all of the layers, all of the social determinants of health, all of the pieces that make up a person, a community, population. That's what's going to be most effective. And then looking at understanding the biopsychosocial factors that contribute to substance use. So wellness models such as the biopsychosocial model that we just covered recognizes the complex interplay of biological, psychological, and social factors in health and well-being. Substance use prevention efforts should take into account these factors and provide interventions that address the underlying causes of substance use. So looking at the person as a whole, their environment as a whole, the policies that affect that person, that population, their health, their substance use. And then we want to understand those biopsychosocial factors that may be the underlying cause of substance use. We want to address motivation and readiness to change. So this is where that trans-theoretical model of change would come into play. Very useful to help recognize that individuals have varying levels of motivation and readiness to change. No two people are the same. We know how challenging that can be at times. And so this is a great framework to address population health and individual health to help prepare people for change and understand where they're at, if they're ready to change, and what stage that they're at. Substance use prevention efforts should tailor interventions to the individual's level of motivation and readiness to change, looking at their personal motivation. And then you'd like to provide resources and support for holistic well-being. The substance use prevention efforts should provide resources and support for holistic well-being, like access to physical activity, mental health services, and social support. These resources can help individuals build resilience and cope with stressors that may contribute to substance use. So, looking at that person's holistic well-being, right? Ensuring there's access to physical activity, mental health services, and social support. We want to build a resilient population, a resilient participant, a resilient client, to be able to cope with stressors without relying on substance. And promoting intrinsic motivation and autonomy. So as most of us know, to really see lasting change, there has to be that intrinsic motivation and a sense of autonomy. So the self-determination theory is a wellness model, and it recognizes the importance of intrinsic motivation and autonomy in promoting well-being. Substance use prevention efforts should aim to promote intrinsic motivation and autonomy, such as providing opportunities for personal growth and development. All right. So all of those beautiful wellness models can be used individually or components of each one together to help tailor more specific programs and interventions for your population that you serve. And now we will kind of switch gears here to looking at substance use prevention and wellness across the lifespan. Again, if you have any questions so far, maybe save them and can email them to me, and I will do my best to answer those questions. So the lifespan is the biological limits to life's length determined by species-specific hereditary factors. So we'll highlight those strategies and recommendations for substance use prevention through various life and developmental stages. So looking at prenatal development and the newborn in terms of substance use prevention and wellness, it's very important to focus on preconception health, especially the clinical recommendations for pregnant people with opioid use disorder. So the current clinical recommendations are including medication for opioid use disorder for pregnant women over withdrawal due to the improved outcomes and the risk reduction of return to use during pregnancy. So this is what's currently recommended for pregnant people with opioid use disorder. So ensuring that there's access to proper comprehensive care to medication for opioid use disorder. This will improve the outcome for the pregnant person and their child. We want to look at exercise, nutrition, limiting substance use, and mental health management. These are all factors that will prevent substance use and improve wellness at the preconception health. And then the pre and postnatal care, these are also very important areas to look at. The risks for substance use increases during this stage. So we really want to look at ensuring there's screening and risk assessments for postpartum depression, anxiety, and substance use among caregivers. And we all know this is one of the most stressful periods for caregivers. And so ensuring that there is support available and there is proper screening to tailor interventions if needed. And continuing medication for opioid use disorder is one of the recommended strategies for that postpartum period, making sure it's taken as prescribed, but that it is available, accessible, and supported by the provider. There's an increased risk for return to use and overdose due to increased stress and life adjustments in this postnatal care part and pre, of course. And then we want to, of course, ensure that there's access to health care and substance use treatment, and really working to reduce the stigma around substance use treatment for people who are pregnant, and ensuring that they're able to access the care that they deserve and that they need to be the safest, healthiest version of themselves. And now we'll look at substance use prevention and wellness at infancy and childhood. So again, going back to that infancy and childhood. So looking at making sure that MOUD is available for the caregiver, looking at exercise and nutrition, and limiting substance use and managing mental health. The recommendations would be interventions to prevent child abuse and neglect, ensuring there's information access for proper nutrition, encouraging healthy caregiver attachment, and again, including risk assessments for substance use disorder and co-occurring disorders among caregivers. Another great one would be including parental support groups to ensure that mental, emotional, and spiritual health is being fostered and supported. Now we'll move over to adolescence and emerging adulthood and look at those risk factors specific for this population with substance use, as well as the protective factors. So some of those risk factors include genetics and family history, the presence of peer pressure, mental health disorders, trauma, witnessing it, experiencing it, low socioeconomic status, lack of parental supervision, and accessibility. So these are all those big risk factors in adolescence and emerging adulthood. So switching over to the protective factors for this population, those include strong family and social supports, as well as positive mental health, healthy coping skills, strong personal values, access to resources, and good physical health. So we can take the information we have learned so far in this webinar to kind of look at how we can ensure these protective factors are developed, implemented, and executed for this population. Right, so here are some recommendations for the adolescents and emerging adulthood. You look at education and awareness, you know that's a big one, right? Increasing education and awareness about the dangers of substance use and the importance of maintaining overall health and well-being. Peer support, encouraging peer support and positive social networks among adolescents and emerging adults. Family support, providing resources and support for families to help promote positive relationships and reduce factors for substance use. Positive reinforcement, promoting positive reinforcement for healthy behaviors such as staying active and making healthy choices. Early intervention, identifying and addressing risk factors for substance use early on before they become more serious problems. And access to resources, providing access to resources and support for individuals and communities that promote health and wellness, such as mental health services, recreational activities, and job opportunities. And now we'll look at substance use prevention and wellness in the adulthood and aging population. So these are some risk factors for substance use disorder in older adults. Chronic pain, physical disabilities or reduced mobility, transitions in living or care situations, loss of loved ones, social isolation, forced retirement or change in income, poor health status, chronic illness, as well as the increased use of medications and supplements. So the National Survey on Drug Use and Health in 2018 indicated that 1 million adults aged 65 and older live with a substance use disorder. So this is a population, I think, that when we think of substance use prevention efforts, it's not necessarily a priority population, but that's a significant number. And when you look at all of these risk factors, it really paints a telling picture of the need for more support and engagement for this population regarding substance use prevention. And oftentimes too, symptoms of some of these chronic illnesses and these disabilities and mobility can mimic that of substance use disorder or vice versa. So I think it can often be overlooked because of these specific risk factors and characteristics of an aging population. So these are protective factors in older adults for substance use prevention. The first one would be long-term engagement in healthcare. So ensuring that there's that accessibility and ongoing treatment and care for this population. Providing cognitive and social engagement. Feeling a sense of community. So reducing that isolation, increasing those socialization, physical activity, and a healthy diet. Again, those are all protective factors in the older adult population. Recommendations for substance use prevention in adulthood and aging would center on screenings for chronic conditions such as cancer, high blood pressure, and type 2 diabetes, screening for substance misuse, immunizations, health education, and counseling about personal health behaviors. Right. Moving along, we will now look more at adolescent substance use prevention and wellness in this population. So I'm sure most of you are familiar with ACEs, the adverse childhood experiences. These are exposure to traumatic events during childhood that increase toxic stress, impacting brain development and how the body processes stress, resulting in negative impacts on an individual's physical and mental health outcomes later in life. The risk factors for ACEs are domestic violence or abuse, parental substance abuse or mental illness, neglect, parental separation or divorce, household instability, and exposure to community violence. The outcomes for persons experiencing ACEs are chronic health conditions, mental health disorders, social and behavioral difficulties, impaired brain development, poor academic and occupational outcomes, and higher risk of experiencing future trauma. So now there's a little video that I'd like to share from the National Center for Injury Prevention and Control, Division of Violence Prevention, about preventing ACEs. So I think Rebecca will help get that going, and I will just go over the rest of the slides. So preventing adverse childhood experiences result in a decreased risk for depression, asthma, diabetes, and cancer. It also results in a reduction in adverse health behaviors such as smoking and heavy drinking, an increased education and employment, and lastly, it breaks the generational cycle.
Hi, this is my neighborhood. I grew up in this building. This is a great community now, but it's had its share of problems. When I was a kid, our community had high unemployment, a lack of resources for families, and lots of kids hanging out with no adult supervision. You might have heard about adverse childhood experiences, or ACEs. ACEs are traumatic events in childhood, like abuse and neglect, that can increase risk for future problems. But they don't have to. The good news is that ACEs and their consequences can be prevented. Take me, for example. I was at risk for ACEs, and despite all the things that put me at risk, some pretty incredible people helped make sure that I wouldn't become another statistic. Come on, I'll show you around. That's Jackson. He's a cool kid. His dad left when he was 2, and his mom works 2 jobs. I hang out with him every Thursday night and help him with his homework. Sometimes we grab ice cream. It's fun. Plus, he has another adult role model to learn from and trust. That's Mr. Martino. When I was a kid, he let me help him at the store sometimes after school when my parents were working late. He did that for a bunch of us. My dad actually found his job as a mechanic because of Mr. Martino. This helped our family in so many ways. Not only did my dad have a steady paycheck, which eased his stress about paying rent and buying necessities like food and clothes, but he was also a lot nicer to me, my brother, and my mom once he started working a job that made him feel good about himself. When communities come together, they can do so much to prevent ACEs. Mr. Martino and other local business owners put together a series of career workshops to help people like my dad find work. My mom also got a job with a company that allowed her to work from home and spend more time with me and my brother. Mariana has just gotten out of a class about handling challenges of single parenting. The clinic offers free childcare so Mariana's daughter, Ella, can play while Mariana's in class. The class helps parents like Mariana develop positive parenting skills, not just for babies and toddlers, but for teenagers too. This is another way our community has come together to give families the resources they need, and just one more way to prevent ACEs. This was my school, Riverside Middle, right in the heart of town. These kids are here for a sponsored summer camp. This community-supported program helps families with affordable, quality childcare and helps kids get tutoring and learn life skills. When I was a kid, I spent a lot of time at this school all year long. There was one counselor, Miss Greer, who I remember more than anyone. She was a really good listener. Miss Greer helped me and my brother get involved in after-school activities like baseball and soccer. Our coaches were super nice and were mentors to us. Staying after school for practice kept us and a lot of other kids out of trouble. When schools help take responsibility for preventing ACEs, everybody wins. My life could have gone in a completely different direction. Studies show that ACEs can have long-term negative effects on kids' health and well-being that may last into adulthood and even continue in future generations. But by people and groups taking action, ACEs can be prevented. In fact, there are 5 known strategies that help stop ACEs before they even start. You can implement them in your own community, just like we did. How? By strengthening economic support for families, by changing social norms to support parents in positive parenting, by providing quality care and education early in life, by enhancing parenting skills to promote healthy child development, and by intervening to lessen harms and prevent future risk. So, now you know my story, and you've seen the prevention strategies in my community that helped me beat the odds. I had healthy relationships with my family and friends. I learned how to take care of myself and make good choices. And today, I'm a mentor to other kids who need some extra help so they don't become an ACEs statistic. Safe, stable, and nurturing relationships and environments are essential to prevent child abuse and neglect and to assure that all kids reach their full potential. Are you thinking what I'm thinking? Banana split? You got it.
All right. Well, I hope you enjoyed that video and were able to broaden your perspective of those adverse childhood experiences and what is really needed to prevent them. It really involves everything across the spectrum, right? It's not just looking at how can we educate parents. Well, we can give them education, but if we don't change the environment of the community, of policies, that information isn't going to be able to be used. There needs to be support for parents, access to free childcare, access to healthcare, employment, all of these things so that parents are able to be present and to give back to their children and their community to prevent the cycle of adverse childhood experiences from continuing. So I would ask if you had any feedback on this, but I don't think I'll see it. So hope you enjoyed that. And before I go over this slide, there is a section I wanted to include that's not on this PowerPoint, but it's about positive childhood experiences. I think ACEs and that prevention video really leads into this section very well. There's a study conducted by Dr. Christina Bell at Johns Hopkins that was released in 2019 on positive childhood experiences, or PCEs, and it highlighted factors that increased resiliency in children that experienced ACEs and thrived despite difficult childhoods. The research identified 7 positive childhood experiences that can be statistically linked to good emotional and mental health in adults. This helps advance research moving forward to focus on increasing positive experiences and building resilience in those who experience or are at risk for trauma. So this helps shape research moving in an additional direction by increasing positive childhood experience to build resilience in children who've experienced traumas and who may in the future. The relationship between positive childhood experiences in childhood and good mental health in adults is dose responsive, meaning the more positive childhood experiences a child gets, the better their adult mental health is likely to be. So those 7 positive childhood experiences are: 1, the ability to talk with family about feelings. 2, the sense that family is supportive during difficult times. 3, the enjoyment of participation in community traditions. 4, feeling a sense of belonging in high school. 5, feeling supported by friends. 6, having at least 2 non-parent adults who genuinely cared. And 7, feeling safe and protected by an adult in the home. So I really enjoy this study. I'm so excited that this is out there, and this is kind of the direction that research is moving, because we think this gives caregivers a positive framework to use that's more empowering and uplifting of what to do versus what not to do. So people reporting positive experiences were less likely to report adult depression or mental health issues. And the more positive experiences that individuals reported, the more likely they were to report few or no issues of adult mental health challenges. So really the goal is to assist caregivers and children in experiencing all 7 of those positive childhood experiences. So talking about your feelings, sensing your family is supportive, participating in community traditions, feeling a sense of belonging in high school, feeling supported by friends, having at least 2 non-parent adults who genuinely cared, and feeling safe and protected by an adult in the home. So I really encourage you to look more into this. It should be linked in the sources in the PowerPoint at the end. But again, it's positive childhood experiences, and it was research conducted by Dr. Christina Bell at Johns Hopkins, and it was released in 2019. Okay, so I wanted to highlight this adolescent prevention program, Girls on the Run. This is a program I have worked with closely in the past, and it's just an incredible program that really focuses on developing pro-social behaviors in adolescent girls. It really focuses on all of these factors that we're looking at: the social, emotional, mental well-being, the community engagement and sense of belonging, physical activity, health, information, feeling a sense of trust and engagement. So the mission of Girls on the Run is to inspire girls to be joyful, healthy, and confident using a fun, experience-based curriculum which creatively integrates running. This is a nationwide program. There are chapters throughout Florida, throughout the country. The statistics at the bottom are published in 2019 in Pediatric Exercise Science from this program. So the results indicated that 97% of girls who completed a Girls on the Run program said that they learned critical life skills, including how to resolve conflict, help others, or making intentional decisions. 85% of girls improved their confidence, caring, competence, character development, and connection to others. And 40% increase in their physical activity level among girls who were least active at the start of the season. So with all of the information that we've covered so far, I hope that you see that this really hits on so many of those protective factors that we want to instill, ingrain, build, and support in our youth to prevent substance use and misuse. This is an incredible program. They use a lot of volunteers. So if this is something that speaks to you, I really encourage you to jump on their website and see if there's a chapter near you to get involved with. There are, of course, other programs similar to this who do wonderful things. This is just one that was more near and dear to my heart, so I wanted to share it with you all. So now we're getting near the end. I just wanted to share some more resources in Florida on adolescent prevention. We've got the Florida Coalition for Children, the Florida Department of Juvenile Justice, Florida Department of Health. That's looking at their programs and services for young adults. The Florida Department of Juvenile Justice, that link there is for their prevention services and prevention programs. We've got the Florida Alcohol and Drug Abuse Association, FADA, of course, and their resource center is linked there. The Florida Department of Children and Families, their resource library, that is the link for there. Central Florida Behavioral Health Network, the link there shows the prevention coalitions that they have. You've got SAMHSA's Prevention of Substance Use and Mental Disorders. That's a direct link to information and resources for that. And let's see. You've got the CDC Adverse Childhood Experiences, so more information on violence prevention and ACEs. The Florida Statewide Drug Policy Advisory Council, which I covered earlier, that's a quick guide to that. The SAMHSA Planning Resources and Alcohol and Other Drug Misuse Prevention Resources. So these will be resources to help assist you in planning and developing substance misuse prevention programs. The last link there is the CDC's training on preventing adverse childhood experiences, if you're interested in that. And then I also wanted to make sure I included the Florida Department of Children and Families Substance Abuse and Mental Health Prevention Services. The website is myflfamilies.com. And then you can go to Services, Substance Abuse and Mental Health. And then there's a link for prevention services as well. And the Florida Department of Children and Families Substance Abuse Prevention. So the website's myflfamilies.com, Services, Substance Abuse and Mental Health. And so some of my slides were not on this one, so that's why I'm reading through them instead of you seeing them, and I apologize for that. More resources are the Blueprints for Healthy Young or Youth Development. It's a registry that includes prevention programs with integrated wellness, like positive action, in shape, and sport prevention plus wellness. That's blueprintsprograms.org. The Community Coalition Alliance is another great resource. That's ccafl.org. Okay, so now I'll just quickly go through the references, if there's anything on here. And then, like I said, I would encourage you all to go back and click on some of these resources, explore things. If anything spoke to you, definitely go learn more. And I wish that I could see the chat if there were questions or comments, but please reach out to me if you have any questions or want to learn any more about what I discussed today. That's my email there again, Bonham-Lovett@exoffender.org. I really appreciate you all being here and being with me, and for getting through these slight technical challenges, and I hope you learned something useful that will help you moving forward with your population and your field. So thank you again. I hope you all have a wonderful rest of the day, and I think Rebecca will take over from here.
Yes, thank you so much, Amanda. We really appreciate all the work you put into this. And once again, to all the participants and to you, Amanda, we're very sorry for the technical difficulty. I just feel terrible that happened. But thank you so much for all of the information that you shared with us and everything that you did for this. And I know if we had the chat panel able to work, people would be saying how great it was, and hopefully people will send you emails and let you know just how good this webinar really was. So thank you so much again, Amanda.
It was my pleasure. Thank you.
Of course. And before we conclude today's webinar, I wanted to let you all know, please see the chat panel for a link to today's survey. Additionally, when I conclude today's webinar, your browser will take you to an evaluation on FATA's website. If you want to receive CEs or a statement of credit, you must complete the evaluation. You will be prompted to register or sign in to complete the evaluation. You can register as a visitor at no cost. For CE to be reported to CE broker, you needed to include a licensed healthcare practitioner. You needed to include your Florida Department of Health license prefix and number when you registered for this webinar. Or sign in, you'll be directed onward to the evaluation. You must use the same email address you used when you registered for our webinars and when you set up your profile in FATA's system, as this is the only way to connect your attendance with your profile. You will get a second opportunity later today through a follow-up email to complete the evaluation. Please remember the evaluation will close midnight Tuesday, June 6th. Please know that we also do not email statements of credit, but after we verify attendance and completion of the evaluation, a statement of credit will be generated as a journal entry within your FATA profile 30 business days after the evaluation closes. Thank you all for participating in today's webinar. We'd also like to recognize and especially thank the Florida Department of Children and Families, Office of Substance Abuse and Mental Health for funding today's education. Have a great rest of your day, everyone, and thank you so much for joining us for today's webinar.